Welcome to our channel for another video. Today, we're diving deep into the skeletal system, the body's structural foundation. This is an essential guide for nursing students and anatomy experts alike. The skeletal system is your body's structural framework. It's made up of bones, joints, and cartilage, acting as the primary support, protection, and movement system. Its main parts include bones for structure, joints for flexibility, cartilage to reduce friction, and ligaments to stabilize your joints by connecting bone to bone. Bones come in many shapes. Long bones like the femur provide movement, short bones offer stability, and flat bones like the skull protect your vital organs. We also have irregular bones like the vertebrae for support, and sesamoid bones like the patella to protect your tendons from wear and tear during movement. The skeleton is divided into two main parts. First, the axial skeleton, which includes the skull, vertebral column, and thoracic cage, protecting your central nervous system and vital organs. Next is the appendicular skeleton. This includes the upper and lower limbs, plus the shoulder and pelvic girdles, which allow for a wide range of motion and interaction with the world. The skull is a complex structure of 22 bones. Its primary job is to house and protect the brain while providing the structural base for your face and sensory organs. The vertebral column, or spine, consists of 33 bones that protect the spinal cord. It provides the central support for the body while allowing for flexibility and balance. Looking inside a long bone, we see the epiphysis at the ends and the diaphysis as the middle shaft. It's a living, active tissue that is constantly adapting. At a microscopic level, compact bone is organized into osteons. These structural units contain canals for blood vessels and nerves, ensuring the bone receives essential nutrients. Inside the marrow cavity, red bone marrow produces billions of blood cells daily in a process called hematopoiesis, while yellow marrow serves as a critical energy reserve of fat. Bones are constantly remodeling. Osteoblasts build new bone matrix, while osteoclasts break it down. This balance is vital for maintaining bone density and strength. Most bones start as cartilage and gradually harden through ossification. The epiphyseal plates allow bones to grow in length until early adulthood. Bone health is also regulated by hormones. Parathyroid hormone, or PTH, increases blood calcium levels by activating osteoclasts, while calcitonin helps store calcium back into the bones. The skeletal system's protective role is unmatched. The rib cage acts as a sturdy cage for your heart and lungs, expanding and contracting with every breath you take. Beyond structure, bones are a massive warehouse for minerals. They store 99% of the body's calcium, which is critical for nerve signals and muscle contractions. Joints are where movement happens. They are classified by their range of motion, from immovable fibrous joints to slightly movable cartilaginous ones, and freely movable synovial joints. Synovial joints are the most common. They feature a fluid-filled capsule that lubricates movement, while articular cartilage acts as a shock absorber to prevent bone-on-bone friction. Different joints allow different movements. Ball and socket joints, like the shoulder and hip, provide the greatest range of motion, allowing rotation in multiple planes. Hinge joints like the elbow allow for simple flexion and extension, while pivot joints, like the one in your neck, enable the rotation needed to turn your head. Gliding joints in the wrist allow bones to slide over each other, and the unique saddle joint in your thumb is what gives humans our incredible dexterity and grip. Understanding anatomical movements is crucial. Flexion decreases the angle of a joint, while extension increases it. Abduction moves a limb away from the midline, and adduction brings it back. Circumduction combines movements to create a circular path. We also have pronation and supination, which refer to the rotation of the forearm and hand. Bones don't move on their own, muscles move them. When a muscle contracts, it pulls on the bone via a tendon, creating movement at the joint. This is the musculoskeletal system in action. As future healthcare providers, understanding skeletal disorders is key. These range from traumatic injuries like fractures to chronic conditions like osteoporosis and arthritis. Fractures are breaks in the bone. They can be simple, where the bone stays under the skin, or compound, which is a medical emergency where the bone breaks through the skin surface. Osteoporosis is often called the silent thief. It occurs when bone resorption outpaces formation, making bones weak and brittle, often leading to hip and vertebral fractures in older adults. Arthritis involves joint inflammation. Osteoarthritis is the wear and tear of cartilage, while rheumatoid arthritis is an autoimmune condition that attacks the joint lining, causing severe pain and deformity. A lack of vitamin D or calcium can lead to soft bones, known as rickets in children and osteomalacia in adults. This can cause significant bone pain and skeletal deformities. In nursing, the neurovascular assessment is critical. Always check the 5 Ps: pain, pulse, pallor, paresthesia, and paralysis to ensure proper circulation and nerve function after an injury. For the NClEX, remember that traction must never be interrupted. Weights should hang freely, and pin site care is essential to prevent osteomyelitis, a serious bone infection. Maintaining skeletal health involves a combination of weight-bearing exercise to stimulate bone building and a diet rich in calcium and vitamin D to provide the necessary building blocks. Bones reach their peak density in your 30s. Building a strong bone bank early in life is the best defense against age-related bone loss and fractures later in life. From the axial protection of your brain to the appendicular mobility of your limbs, the skeletal system is a masterpiece of biological engineering and physiological balance. Understanding this system is more than just memorizing names. It's about appreciating the dynamic, living foundation that makes every movement and every breath possible. Thanks for watching, and don't forget to subscribe for more nursing content. Your support helps us create more educational guides to help you master your exams and your career. See you in the next video.